Hi, everyone. Welcome back to another episode of the Mission Brain podcast. I'm your host, Ali Azan Ahmed, and I wasn't going to let Ashish take away my job permanently since he did the last episode. So I got to jump back, lock in, and have this next episode with you guys right away. Today is an especially amazing episode because we have our host, who is also an alumnus from my college, and he's also a huge inspiration to a lot of people at my campus who want to pursue the brain path. I'd like to welcome Dr. Umar Choudhry. He is a board certified, fellowship trained cerebrovascular, endovascular, and skull based neurosurgeon who was faculty at the University of Pennsylvania. Before that, he trained at Stanford University, UCSF, and in the University of Texas, and received his medical degree from the Aga Khan Medical College in Karachi, Pakistan. With over 15 years of experience and more than 2,000 neurosurgical cases, he specializes in brain aneurysms, AVMs, moyamoya disease, stroke, skull-based tumors, and pulsatile tinnitus. He's also an active researcher and mentor, leading a lab focused on cerebrovascular outcomes, traumatic brain injury, and expanding access to neurosurgical care. Dr. Omar Choudhry, welcome to the show.
Thank you, Willie. Thank you for the kind opportunity to be a part of this wonderful platform in which you are, hosting a lot of people who could be inspiring the future generation and improving the access and impact of neurosurgery training as well as care around the world. So it's my pleasure to be here.
Thank you so much. It's a pleasure to have you on the show. So, Dr. Chaudhry, our theme for this month is neurosurgeons work globally and who have an element of global healthcare to their work. And I want to jump ahead into our first question, which is you train at some of the most prestigious institutions in the world, Stanford, UCSF, UT Houston, and then you went to medical school at the Aga Khan University in Pakistan. How did that global journey shape who you are as a surgeon today?
That's a great question, Ali. I think, it's always helpful to go back and reflect on our roots and where this all started and stuff. And I think the key roots for all the inspiration is, of course, the impact neurosurgery has on all of us and how we find that field very inspiring and enchanting on multiple levels. And I do think that having gone to medical school in Pakistan at the Aga Khan University and then train in the US, it is very easy to understand the differences and also the big divide and the access as well as in terms of the resources and the degree to which we are able to touch upon the neurosurgical care in different parts of the world. So I think it is important for someone like myself and also for others to create a more uniform platform in terms of neurosurgical care around the world. And I think those differences are seen much more clearly and much more magnified as you advance in your careers. And I do think that neurosurgery, compared to other fields, is still a fairly a young field. And I do think that the innovations are up and up every year. But I do think it's important not to limit those innovations to the developed countries, but also to the developing world, and also to make sure that we can have out of the box ideas in terms of making things work in a low resource setting. And I think that's one of my missions to really see how what I do in neurovascular surgery and skull-based surgery can really be translated to third world, both in terms of training, in terms of innovation and education. And I think in terms of the disease burden, there are some very interesting questions that can be answered, and also in terms of growing the mission worldwide.
Amazing, Dr. Chaudhry. And I just want to extend from that answer. You mentioned how neurosurgery is a fairly young field compared to other surgeries. And then you also mentioned your work in neurovascular neurosurgery. And for our listeners who are from across the world, who may not be familiar with your subspecialty, what exactly is cerebrovascular surgery and what exactly is endovascular neurosurgery? And why does it matter on the global scale?
Uh, that's a wonderful question. I think it's important to know that, I still remember that, when I was in medical school and you're just starting to learn about the field of neurosurgery, it was just neurosurgery, neurosurgery. There was no like subspecialization or the concept of, this is spine surgery or this is cranial surgery. But I think, when I started residency, and I think Also in the US, all the programs are academic programs are getting super subspecialized, where at one point, if you looked at smaller programs, you would have a group of four neurosurgeons who would do everything. But now slowly and slowly there's smaller subspecialties in neurosurgery. And that's why I find the field of neurosurgery so important and amazing for the upcoming trainees, is because you can find the correct niche for yourself within the neurosciences atmosphere. So what are the subspecialties? That could include things such as spine when you focus on spine, it's peripheral nerve, and it's brain trauma when you deal with brain trauma issues. Brain tumor neurosurgery is a subspecialty. Functional neurosurgery for patients with functional disorders such as Parkinsonism and functional disorders, depression, things like that. And then cerebrovascular neurosurgery and skull-based neurosurgery is what's specific to me, is basically taking care of problems of the blood vessels of the brain and the spine. And that could include things that can go wrong with blood vessels. So a bigger issue around the world is the issue of blood vessel health and stroke. So you could have occlusion of blood vessels causing stroke, or rupture of blood vessels in form of brain aneurysms, which is an issue and can be a life-threatening condition. And so that's kind of what encompasses the cerebrovascular neurosurgery. But the innovation part in my field is the fact that I would say ever since the late 90s, there have been tools which allow us to function kind of analogous to what the cardiologists do for the heart, where we can do things through the blood vessel by a technique called endovascular neurosurgery. So we were able to access blood vessels by means of catheter going through the femoral artery or the radial artery, and take pictures of the blood vessels, and also do treatments with very fine, innovative tools, which was not possible because previously it was always an open brain surgery for treating aneurysms, for treating brain vascular malformations. So there's a lot going on in our field, and it's exciting. And I think that's kind of what the cerebrovascular endovascular neurosurgery encompasses. And just to add to it, skull-based neurosurgery refers to taking care of disease and pathology, which is at the base of the skull. So if you were to take a specimen of the human skull and you were to look at the bottom of it, that's your skull base. So that's the bones that, create the base of the skull, in which the brain and the CSF and the blood vessels are sitting. And that skull base includes, parts of the occipital bone, the temporal bone, also the frontal bone, and it includes pathology which is hard to reach. So skull-based neurosurgery includes doing all these approaches and procedures to get to tough corners at the base of the brain for treating brain tumors and other vascular problems. So I hope that summarizes kind of the spectrum of the things that I treat in my practice.
That completely captures it, Dr. Chaudhry. That I think that is the most complete description you could have in such a short time. But just building on that, Dr. Chaudhry, you mentioned how endovascular neurosurgery in the late 90s, as you said, has really changed the game on how we do cerebrovascular neurosurgery. How has it changed in the last 2 decades, and where do you see the boundary between open microsurgery and endovascular treatment shifting in neurosurgery?
That's a very good question, and I think it's a natural transition into what we were talking about. So, I will say that one of the big reasons I went into neurovascular surgery was my love for anatomy and my understanding of really working at the highest level or the peak of excellence of microsurgery, where you're able to operate on tiny structures without disrupting normal anatomy and be able to treat that. And, one of the leaders of that, was, of course, Yashragil, who came up with the microscope and allowed us to do all these things. But I think if we take a step back, we always have to think about what is the overall goal, is to basically help the patient without disrupting their normal functioning of the brain and normal anatomy. And yes, I mean, good microsurgery for the right indication is a great way of fixing those problems. But the problem is that now in the US and around the world, we have an aging population. And on top of that, the craniotomy procedure itself is fairly invasive. Even if you do minimally invasive approaches, it is something that requires a day or so in the hospital. It has risks which may be prohibitive if someone has cardiac issues or respiratory issues and they cannot undergo general anesthesia or other things. And I think that's where endovascular neurosurgery really shines. So, the reason why I mentioned the late 90s is because even though there's been a lot of great contributions in the 60s, 70s, and 80s in the endovascular field, but the true maturation happened in the late 90s when the first tool for treating brain aneurysm, which is called the GDC coil, and it's named after the inventor. It's called Guglielmi detachable coil, was approved by the FDA in 1998. And the cool part is that once it was FDA approved, it was the first FDA approved product that could be used for treating brain aneurysms. And once that happened, it kind of opened a window for really making a statement and saying that endovascular is a well-recognized area for treating brain aneurysms. And again, there's a lot of trials that came through. And, earlier in my training, there always used to be a debate at all neurosurgical meetings, which is better. But my answer has always been is the right treatment for the right patient and the right pathology. So the endovascular neurosurgery, to answer your question, is exciting because everything that you do is done from the radial artery or the femoral artery. So you are not making any incisions in the head. You are not doing a large craniotomy. You are not doing super invasive things that require a lot of expertise and support and postoperative care. But then it opens a window for using some very cool devices for treating different problems. And I'll just give one example, which is a device which is called a flow diverter. A flow diverter is a special kind of stent that can be placed inside a blood vessel, such as the carotid artery or the vertebral artery or the middle cerebral artery. And it is used to treat aneurysms that are very wide-based, which means that they don't have a narrow neck to them and they look more like, a sessile structure. And those aneurysms are typically very hard to treat with endovascular coils because the coils won't stay there and you have to use a stent. But the technology of a flow diverter is something that came through some very esteemed figures in the neurovascular world, such as Peter Kim Nelson and AJ Waklu, who are very well recognized radiologists and also some innovators who first developed this device. It was being developed in Europe and also in the US, but the first device came out of Chestnut Medical, which was then acquired by another company called EV3 and then Covidien and Medtronic. But the bottom line is that that device changed the field in terms of the way we looked at aneurysms and our understanding of how a large carotid giant aneurysm can be treated with placement of a stent through your wrist. And the occlusion rates approach somewhere between 80 to 90% at 6 months, which is mind-blowing. And these patients are able to go home in many cases the next morning or the same evening, and they just have to be on blood thinners for 6 months or so. Versus someone getting that same aneurysm treated with open surgery would probably be in the hospital for at least 3 to 4 days, would have an incision, would need a few weeks to heal. So time off from work and all of those things all differ. So in terms of simplification, the minimally invasiveness, and really working on the cutting edge of innovation and biomedical engineering is a really cool part in which all these things that are happening in the neurovascular field. And if you go to one of these major neurosurgical meetings, you'll be surprised how many new companies and startups and devices are there in the endovascular world. And the key goal being, just like I started answering this question, is to make it as simplified and as minimally invasive for patients while giving them the same cure that they would have gotten from open surgery.
Amazing. Dr. Chaudhry, it is so inspiring to hear this journey of neurovascular surgery transform with innovation. And I don't think it's going to stop anytime soon. Instead, it's going to grow exponentially. And that helps us transition into the next segment of the podcast, which is the research element of your work. We know you're an avid researcher. You have over 160 peer-reviewed publications. But what is that one question in your research lab that you're most excited about?
Yeah, I mean, I often think that, we have finite time as humans on this planet in terms of, things that we want to fix and things that we want to learn about and answer. But it is an arduous journey a little bit, for a surgeon who wants to be a scientist or is a surgeon scientist because you have a finite amount of time, and the support from organizations and from academic centers is always a balance between the clinical productivity and the research. But if you were to ask me one thing, I would say it is answering the interplay between the cerebrospinal fluid, the venous system, and the lymphatic system in the brain. And is my opinion the question that I would like to answer in my career. And the reason why I say that is because, the cerebrovascular disease revolving around brain aneurysms, which come out of arteries, which are the high flow blood vessels, and again, carotid disease, they're all arterial problems. But I do think that we're at a very exciting juncture where we're understanding how equally important or more important veins would be, and how the interstitial fluid and how the CSF interactions with that could be a very important part of the puzzle that we've been missing. So all the treatments that we were doing as neurosurgeons were very structural. You see an aneurysm, you clip it or you coil it. You see a blocked blood vessel, you open it. But I think now it's a very interesting time where we're slowly stepping into a functional neurovascular realm where we're really talking about how we can modify function, how we can change things or understand things by looking at not just the arteries, but at the veins and the CSF and the interstitial fluid. So I think that would be the big research piece that is kind of the center of my lab and my future endeavors.
Amazing. And I think we're all very excited for you to find the answer. And I think all of people in the audience can also start looking up this question. So very exciting, Dr. Chaudhry. I'll move on to the next question. We want to discuss how cerebrovascular neurosurgery plays in the global framework. Socioeconomic status seems to play a role even in something as acute as aneurysm treatment. And your work on the area deprivation index and treatment selection for aneurysms is extremely striking, Dr. Chaudhry. What did you find and what should we do about it?
Great question. And I think that's a challenge because microsurgical clipping in most recognized neurovascular centers in the US is probably only happening around 20 to 30% of the cases. And I do think that that's the right balance because those are the patients with aneurysms with no good endovascular solutions. Microsurgical clipping has excellent data on durability. So younger patients with aneurysms that are easily accessible should be treated microsurgically, and there's no harm with that. But we do have to understand that you got to have a good microscope. You got to have the instruments. You've got to have post-operative anesthesia care and ICU care and managing complications. All of that stuff is important. Stuff that we take for granted in a developed world, but it is sometimes not even available in many countries, for example, in the Africa and South Asia and stuff. And one of the reasons that I've often heard and why microsurgical clipping is still the dominant way aneurysms are being clipped in the third world is because the tools and the technology for endovascular are too expensive, and that's limiting. And I do think that there is a lot of excellent work that is being done and can be further promoted in terms of having low cost alternatives for endovascular treatment in the third world. And I do think that local production of coils that can be made at very low cost, use of catheters that are much more affordable compared to microsurgical clips, and it really cut down the cost for endovascular treatment compared to microsurgical clipping. And I think it's very doable. I think one of the places that it is being done very well more and more is India, for example, where they are doing a lot more endovascular treatment. They've found some cool ways of using catheters in ways and really engaging some of these neurovascular companies in ways that allows us to treat aneurysms in a very low cost fashion, so that just like the US, the endovascular strategy becomes the preferred strategy for treating a lot of these ruptured aneurysms, which are a big burden in a lot of these countries. So I think partnership with industry, looking out of the box, simplification of treatment is very important. And one missing piece that we often don't talk enough about is that it needs some infrastructure as well. For you to do endovascular treatment, you need a biplane angiography machine, which can be anywhere from $1 to $2 million. So I do think that on that front, partnering with some of the manufacturers for some of these companies to provide equipment which has easily like good 10 years of life in them to some of the countries at a much lower cost, and also engaging some production from China and other countries where some of these things are being manufactured at a lower cost to really set up an infrastructure for some of these things would really help promote endovascular. So I think that's where the biggest impact needs to be made, is to make it a much bigger norm to do endovascular treatment in the third world. And I've had some friends who've had a chance to work in Africa, and I think there's been great work being done in some of the countries where they were basically non-existent endovascular strategies. So I think it is important to keep the rest of the world up with the times in terms of innovation. And I honestly do feel like the endovascular model works for the developing countries because these patients can, in many cases, be in and out. They don't have to be in the hospital for a long time, so they're not using a lot of those resources where the money is going towards in terms of the ICU care and inpatient care. So I do think that there's some innovative ways in which we can think out of the box to making the neurovascular model for treating brain aneurysms, for treating stroke, for treating AVMs much more workable for the third world by tweaking a few pieces and closely working with industry and the manufacturers.
Amazing. I think, and that's the main takeaway from our podcast, how we could have this global bridge of collaboration from, say, China to India to then the United States that allows us to promote of accessibility to neurovascular neurosurgery. And Dr. Chaudhry, we want to thank you for your work in this field. And I think as we move on with innovation, it's also important that this is shared innovation, which leads us to the next question, Dr. Chaudhry. What do you feel are the biggest challenges as we move towards sharing innovation in the global landscape of neurovascular neurosurgery?
Great question. I wish there was a simple answer, but I think it is important to recognize that, it's a level playing field when we are talking about, innovation. The greatest of the ideas in any specialty or any field or any industry can come from any part of the world. So I think, just really understanding that it's like a global village and concept is super critical. You don't really have to have all the bells and whistles to really think of a great idea. And just to give you an example, historically, I'm a big neurosurgery history buff. So, if you think about the origins of the field of angiography, it came from a neurologist from Portugal, Edgar Moniz, and who basically started getting interested in it. One of the great people from Russia who came up with the early devices for treating aneurysms with like a detachable balloon was Serbienko. So again, a great, where you really wouldn't think that this is where all these things that change the world are coming from. And similarly, when you think about the whole the coiling journey with Guglielmi and everything, it's from Italy. So I think it is important to know that there is no boundaries when we talk about innovation, when we talk about the pursuit of improving patient care and hinging it on innovation. I think it is important to know and I think the work that Mission Brain is doing in terms of really allowing access to students and neurosurgeons to some of these centers and personalities, and then being willing to join hands with them is, I think, extremely important. And I think these are the small steps that can be taken to really make an impact in terms of a shared innovation model. I do think that there have been some interesting initiatives. Like I have seen some innovators coming out of the US or other countries often go to other countries for testing out their products. For example, in South America, in Argentina, there's been a lot of testing going on for new innovative devices even before they come to the US because they may not have that much stringent laws in terms of running clinical trials and stuff. Or let me put it in a more positive framework, be more accepting of innovative trials in other countries, which are great. And similarly, in some countries, there's more disease burden for certain neurovascular diseases compared to the other. For example, in Asia and China, there's a lot of intracranial atherosclerotic disease. So if you're doing or studying an innovative product or an idea for intracranial atherosclerosis, if it's coming from China or if it's being tested in China, that gives you a whole a layer of credibility and data to build your product on. So that gives you an idea in terms of there's geographical differences in terms of disease burden, and then there's resource differences and political and innovation acceptance differences in different markets around the world, which is why shared innovation is so important because you could come up with a device in country A and you may want to test it out in country B and kind of see if it's helpful or successful or not. And if you were to stay in a silo and say, listen, I'm only going to develop a product in the United States and test it in the US and build it in the US and only apply to the US, that doesn't work. So I think we're slowly seeing that shift where not just personnel, but ideas, testing devices, and international conferences are much more well attended by members all over the world, where that shared innovation global model becomes extremely important. And we've seen some excellent innovation, not just neurosurgery, but when we talk about, uh, nutrition or childhood malnutrition work that's come out of Al Khan University, like for Zulfikar Bhutta, and the work has been recognized all the way up in University of Toronto. And that's a great way of kind of exemplifying shared innovation where something doesn't have to be too complicated. It could be something very basic. Something could be very institutional from one place and can really make an impact worldwide by sharing those ideas and by really growing them further in different environments where it would be a fertile ground for that.
Amazing. Thank you so much, Dr. Chaudhry. And I think you also gave us the caption for the episode, which is there is no boundaries. And that's the message we want to spread
Yeah.
across as we move on with our mission and through with this podcast as well. Now, I'm quickly going to close off with this one last question. And I think uh, people in our audience are most eager about this. What's your one piece of advice that you would give to someone who's starting their neurosurgery residency this summer?
That's a great question. So I think the most important thing for someone who's starting in neurosurgery is you know the obvious or the surface things are always there, right? We love the field. We like operating on the brain or the spine because we find it challenging and gratifying, and all of those are things that go without saying. But I think the most important or basic inherent question that I would, really force people to think about is what impact you want to make, or where do you think that you want to leave a mark? And because I think that becomes more important, and it could be anything. For some people, it is important to leave their mark or leave their legacy in terms of training the next generation of neurosurgeons. Absolutely fine. It's a great thing where you want to inspire people and you want to make sure that you do your best job in being a great neurosurgical teacher by making contribution in education. For others, it could be research. For others, it could be, doing, overseas work in terms of, sharing neurosurgical care or underserved areas. And really staying true to that mission is important. And you kind of discover yourself as you go through the neurosurgical residency. But somewhere, in the middle of your training, often many people tend to lose that, where that initial bug or that initial thing that got you into the field kind of gets lost and it gets more focused on just, profession of just doing surgery and going home. But I think thinking about that bigger mission about what you want to do with this rare opportunity you've been given to be a neurosurgeon, of not just treating patients, but going beyond that, I think is extremely important. Um, and and you could rediscover that mission or that calling as you grow. But really trying true to it is important, and not getting distracted. I would like to emphasize the importance of really kind of sharing your knowledge and expertise, and always being willing to grow and to learn. I think it's a lifelong learning journey when you're in a field like neurosurgery, because there's so many new things we're learning every day. It's not a static field. That's the most exciting thing. And being willing to, really participate in efforts that are more global can really help, not just help you learn, but also help you kind of share some of your ideas, which is very important. I've been lucky to interact with and train with, trainees from different parts of the world in neurosurgical residencies or fellowships and stuff. And I think for me as an academic neurosurgeon, learning from them during the process of training them is probably the most gratifying thing. And that something that you don't realize until you've spent a good number of years, training people in this neurosurgical field. And then the other advice I would have is that don't limit yourself. Okay. Something may seem hard or impossible. I'm talking about opportunities. I'm talking about life situations. I'm talking about, things that you come across, but always be willing to, take that step and move forward. Because if you don't try, you would be the first one to count yourself out. So it's very important to keep that positive mindset and keep moving on, and whatever is most important to you in neurosurgery. And I do want to thank you, Ali, for this opportunity. I have seen the origins of the Mission Brain project during my training, where I had a chance to interact with Alfredo Quinones and April Sabangan and all those people who started this. And I think it's really has had a wonderful effect, clearly evidenced by you getting involved and starting this podcast and being a part of this. So always happy to mentor students, have them reach out to provide them a window into what our field is like, and what we can do in their geography to make it more of as you mentioned, a shared platform for moving the field forward. So thanks so much for the kind invitation, and my email is right up there, and happy for people to get in touch with me.
Thank you so much. Thank you so much, Dr. Chaudhry, for those wonderful responses. And thank you so much for taking out the time for this podcast. I'm sure our audience would love to hear more from you. And I think the one comment that I'm going to leave in the description is, what impact can you make? And we loved hearing it from you, and hopefully the audience can share their impact in the comment section. Thank you so much, Dr. Chaudhry. We're going to wrap it up with this, and we'll see you soon.